And you're really a major trauma center as well, aren't you?
We are. We're actually verified by the American College of Surgeons as not only a trauma center for adults, but a trauma center for children. And frankly, we are one of the only hospitals in the state that has both verification for adults and children.
That's amazing. That's wonderful.
Yes.
That's wonderful. And what have some of these renovations brought about in terms of what a patient may see or the technology that you have available to you?
Great question. First and foremost is we try to improve the patient care experience with the renovations. So now all the rooms in the emergency center are private rooms. And they're private rooms that are large enough to accommodate not only the patient, but their family members. So the family can wait with the patient in a private setting where whatever concerns that they might have about the care that they need or the condition that they have remains private.
And the family becomes a patient as well.
Well, they do, or they certainly become a big support system for that patient. And we found that, frankly, when people are sick, the whole family oftentimes gets in crisis, and they need to kind of coalesce together and help each other through it. So I think it was a great development. Also, there are certain amenities that we weren't unable to provide before, such as TVs in every private room, so that when patients do have to wait for testing results to come back, at least they can bide their time by watching a TV or taking their mind off of whatever's going on by watching a TV, which is good. We've moved a lot of the diagnostic testing right to the emergency center, CAT scans right in the department, X-ray equipment right in the department, so that we can expedite that testing for the patient.
So a patient doesn't have to be transported, perhaps delaying
Exactly.
The result that you want to obtain.
Exactly.
You also have something called a critical decision unit, and what is that?
A critical decision unit is an area of the hospital, again, a recent development at St. John, probably in the last 2.5 years, whereby if patients do not meet criteria to actually get admitted to the hospital after a full workup in the emergency department, but are still too ill to go home, this is a place where we can put a patient and rapidly get them through diagnostic testing to find out what exactly is going on and whether or not we need to move them to an inpatient setting for more treatment or whether or not we can safely send them home for further outpatient treatment. Most of our patients that end up in this critical decision unit, where a doctor is there 24 hours a day to be right at the bedside should the patient need anything, we get patients through that system in about 15 hours, which is very, very rapid.
It is rapid.
Yes.
And I think it's an important point, and I'm glad you mentioned it, that the Bull family has been very generous in donating many things to the community and the state. And something like this really wouldn't have been probably possible without their generous donation.
I can't thank the Bull family enough. As you mentioned, they are a tremendous asset to our community and to the greater community with the philanthropic efforts that they've put forth over the years. And John and Marlene Bull and their entire family should be commended for what they've done for our community.
I agree. Tell us a little bit more about the designated pediatric unit in the ER.
Well, again, we are one of 2 hospitals in the city of Detroit that actually has a pediatric emergency center. One would be Children's Hospital of Michigan, and the other is St. John Hospital and Medical Center. We have board-certified emergency physicians that have done specialty training in the treatment of pediatric emergencies, and they are there in our pediatric emergency center for any emergency that a child would have. And they go through this specialty training, another 2 to 3 years of training beyond what it takes to become an emergency physician. So they have about 6 years of postgraduate training specifically designed to have them prepared for anything a child might need in an emergency manner.
And although we may be aware that many people may not necessarily know that there are very unique situations that involve children, that having that expertise available all the time is vital.
Absolutely. I think anytime a child is in either a traumatic or a medical emergency situation, as a parent myself, I take great comfort in knowing that those sorts of experts are ready at a moment's notice to intervene in the well-being of my child.
And you also have a special accreditation for stroke and chest pain and heart failure?
We do. There are accrediting bodies now across the United States that are looking at how you intervene in certain medical conditions, and using state-of-the-art equipment as well as state-of-the-art therapies, and putting forth applications to these bodies. They will certify you in certain aspects of healthcare. We at St. John have been very aggressively pursuing these accreditations, and as you mentioned, we are accredited now as a chest pain center. We are accredited now as a heart failure center, and we're accredited as a stroke center, which means that we have put together treatment plans and processes such that we bring state-of-the-art care to patients in a timely manner that can treat these conditions as well as anyone else around the state.
Dr. Fox, as a follow-up to that, what are some of the time-sensitive, important things that you treat relating to stroke and heart attack and so on?
Well, those two illnesses are very time sensitive. There's an old adage in emergency medicine that time is muscle when it comes to a heart attack. And so I think the public understands that when they have symptoms of a heart attack, it's very, very important to get to an emergency department very quickly. The quicker that we can see you and diagnose the problem, the quicker we can get the closed vessel, artery around the heart opened up to save the heart muscle. The same is true for stroke, and this is a very exciting aspect of emergency medicine that's really come to the forefront over the last 5 years or so. We now look at strokes as brain attacks, if you will. Much like we talk about a heart attack, we talk about a brain attack. And the condition is very similar to what we see in heart attacks, in that the blood supply to a portion of the brain gets blocked for whatever reason. There's a number of different reasons that can cause it. But the fact that it's blocked means that we have an opportunity, if we can get that blockage opened up, to save part of the brain that wouldn't be saved unless we opened up the vessel. So we're very aggressively managing patients with stroke symptoms, and we'll give them either medication to open the blockage, or actually take them and have neurosurgeons put in stents to open up these vessels and allow that blood flow to occur again.
And relating to a heart attack or a possible stroke, how much time do you have for that intervention?
Well, great question. The sooner we get to the patient, the better, regardless. Right now, we'd like to get stroke patients into an intervention within 3 hours of symptoms.
So 3 hours is vital.
Well, it's certainly important, but we have, under certain circumstances, extended that window and actually gone beyond the 3 hours and have had very, very good results when doing that. But again, the sooner the better. Much like with heart attack, we have certain protocols in place that we try to get the patient from the front door of the emergency department to the cath lab and having the vessel opened within 90 minutes. We're actually pushing that time envelope down and trying to get to 60 minutes. And I think we'll get there very, very quickly with the processes that we've put in place.
And what are the various means that you have through medication or stents and so on to open up those clogged vessels?
Well, let's talk about heart attack first. There are medications that can be used, but most of the studies show that if you can get a patient to a cath lab and actually have the vessel opened via a balloon and then place a stent, the outcomes are usually better. So at St. John, we're available 24/7 to be able to get people to the catheterization lab to actually get a balloon into that closed artery, open it up, place a stent if necessary, and outcomes are better. There are medications that we use in heart attack that can open clogged vessels, but typically patients will get medication like that at hospitals that are not equipped like St. John's. So hospitals that might be out in more of a rural setting is when we'll use medications like that. The same is true for stroke. We use TPA in stroke right now.
And TPA is?
It's a medication that's, that breaks down clots.
Okay.
And in using that medication, it's very aggressive in breaking down the clot and opening up vessels. But again, because of the technology that we have at St. John, we oftentimes will take patients directly to a cath lab for arteries in the brain, and have neurosurgeons actually do diagnostic studies to see where the blockage is and see if they can't open it, much like we open vessels around the heart.
That's amazing.
It is amazing.
Now, should a patient, if they think they're having a heart attack, while they're waiting for an ambulance to come or have somebody drive them, should they take aspirin or do anything in the interim?
Well, if they're on a daily regimen of aspirin, the answer would be no. An aspirin a day is sufficient. If they don't take aspirin, yeah, I think just taking one adult aspirin would be a great first step while you're waiting for someone to take you to an emergency department. It'd be great advice.
And do you have any advice for any family member to prepare themselves for some minor incident that may occur at home that they don't need to go to the emergency room for?
That's a great question. It's the advice that our moms all gave us, right? But oftentimes, again, if you're prepared, it's much easier to address minor emergencies at home than if you're not prepared. So just having a first aid kit around the house is great, whether that's bandages or topical antibiotic creams or whatnot, for the sorts of cuts and scrapes and minor burns that children or sometimes adults will get when they're doing household chores or work around the house, whatever. Those are probably the best things to have.
And is there anything different that may involve a work situation that you would add to that, or is it about the same?
Well, I think, again, having a first aid kit at work, depending on the type of work that the individual does, those sorts of minor things can easily be handled at the office or at the factory or wherever the person happens to work. So common sense is usually the best thing to keep close at hand when facing minor emergencies. So.
And I think a key that you said is be prepared. Although we may never end up in an ER or don't want to, a key is to be prepared so that if we do happen to make that trip, we get the quickest and the best service.
Absolutely. What we want is a good outcome for all the patients that access the emergency center at St. John. So the more information that you can provide to an emergency physician as we intervene in your health care, the better outcome that we can all hope for.
Well, Dr. Fox, thank you so much. That's valuable information. We all appreciate it, and thank you for being a guest on In a Heartbeat.
It's been my pleasure. Thank you for having me.
Thank you. And thank you to our viewers as well for tuning in. We appreciate that. Take good care of yourself and those around you, and we'll see you next time.